just wanted to start with just by saying hello to everyone. This meeting will be, like we said, we're recording it and it will be put on our website so that not only our chapter members, but other people that are involved with our CARE program can go on and take a look at and see what it's all about. So I'm Juanita Smith, and I'm a member of the Central Illinois chapter of the Links Incorporated. This is Dr. Timby Connor Garcia. She is also a member of the Central Illinois chapter of the Links. And we have as our special guest today, Dr. Yogesh Agarwal. He's a cardiologist for OSF Cardiovascular Institute in Bloomington. And we are so happy to have you here with us today, Dr. Agarwal. Thank you so much for taking the time out of your busy schedule. We can see you're busy. You're running from place to place. So we appreciate you being here with us. So welcome to you. And we want to start out with, if you'll kind of give us a little tidbits about yourself. Tell us a little bio about you and tell us what, exactly what you do. And we know that cardiology is a pretty broad field. If you can kind of just tell us what you do in the cardiology field.
Thanks, Juanita. First of all, I just want to thank you and Dr. Connor for inviting me over. I am Yogesh Agarwal. I work as a cardiologist for OSF Bloomington here in Illinois. So I did my med school in India and came to US in '96. I did my internal medicine residency, did a fellowship in cardiology, then worked as a general cardiologist. And then about 6 years later, I went back and did another year of fellowship to do interventional cardiology. So I'm what is called an interventional cardiologist. My specialty is to do stents when people have heart attacks or if they have chest pain, they have a blockage. So I'm the person who goes in, puts a stent in and helps people feel better. So that's my specialty within cardiology.
That's very good. Thank you so much. Well, now we realize that this is, like I said, February is Heart Health Month. And so we, our organization, we do things and activities that help our community see and are able to support our community in making them aware of cardiovascular disease and how that cardiovascular disease affects our kidneys. Our kidneys is one of our programs also that we're doing. So can you tell us a little bit about that, Doctor?
So it's actually very interesting that heart disease and kidney disease are kind of linked in very intricate ways. They are two very important organs, and a lot of patients that I see who have heart disease of any kind, and when I say heart disease, I mean people who have blockages and have chest pains, but there's a big proportion of patients who have congestive heart failure, people who have high blood pressure, rhythm problems. So all of these are interlinked with each other. So if I were to guess, I think at least half of my patients who have heart disease have some amount of kidney disease. So it's a very prevalent problem that we see in our heart patients. So I think targeting both is really, really important for overall health of an individual. So I applaud you that you're doing both and, helping people with kidney disease and educating them and for heart disease.
Mm-hmm. Wow, that is astounding. I knew that the numbers would probably be high with patients who have heart disease, who also have some form of chronic kidney disease, but to hear it from a practicing cardiologist, it just makes it all that more impactful. Mm-hmm. In terms of the population and all that you see there in Bloomington, because with the kidney program that we've partnered with, we've seen that it tends to be African American communities that are more affected with chronic kidney disease. Are you seeing this as well in your practice in terms of those with heart disease and comorbid chronic kidney disease? And would you be able to maybe quantify about how many African Americans in your practice, what percentage have heart disease and chronic kidney disease?
So my perspective is a little skewed, just because people who come to me have some kind of heart disease already established. So I'm not seeing a wide a cross section of population as such. But among them, I find a lot of African Americans, especially, I think I can see all of them have high blood pressure, which I think is a little harder to control in the African American population. Their underlying physiology is different from a Caucasian population, so there's that difference there. And we do know that African Americans who have high blood pressure tend to have poorer consequences from that high blood pressure. They tend to have more kidney issues, more heart failure issues, and things feed on each other. So the African American population that I have in my office, for the most part, a lot of them, and I can't offhand give a number, but I would say at least half to three-fourths do have some amount of kidney issues going on. But that I would just, the caveat is that population that I'm seeing is already has vascular disease and hypertension and diabetes. So that population selects itself out a little bit. But it's a very common, and as I do think most experts agree that the consequences of hypertension and diabetes seem to be more severe in the African American population compared to the Caucasian population.
Okay, that makes a lot of sense. So do you think is it more challenging then to treat your cardiac disease with like if a patient also has CKD? Is it challenging? I mean, for your medications, do you have to to do different things, or I'm just curious.
No, very, very good. And I think there are about at least two or three points to make in that regard. One is that people who have chronic kidney disease are much more likely to have heart disease. That's one. And the worse the kidneys, the more chances that they will develop heart disease. And so that's really important. So people who have kidney disease, I would focus very strongly on preventing heart disease because they're much more likely to develop that. So that's point. Point number two is that when people with kidney disease do develop heart disease, like have a heart attack, they tend to do poorly. They tend to have higher chance of dying, suffering more kidney damage. So they need more attention after an event because they tend to do poorly compared to person who don't have kidney disease, everything else being equal. And the third thing is that kidney disease by itself may add some risk that is just beyond what we call traditional risk factors, meaning we think about high blood pressure, diabetes, cholesterol as the causes of heart disease, and we manage that. But having kidney disease seems to add another layer of risk to them. And so managing the underlying diseases becomes challenging. And fourth thing is that medications that we use sometimes for heart disease patients we have to be careful that they don't affect the kidneys adversely, that don't exacerbate an underlying problem and cause more problems on top of that. So it's a somewhat of a fine balancing act and being aware of the heightened risk that is involved in our population with chronic kidney disease. So those are the few to think about.
Okay, thank you.
Well, thank you for breaking that down in points like that, because sometimes I think it's easy for us, especially people who are not medical. We think, okay, well, they have a heart problem and they have a kidney problem. And sometimes we tend to think that these are two separate things and they don't necessarily go hand in hand and affect ability to treat one another. And I think that you nicely outlined that in the answer that you gave, and really emphasized the importance and how these two disease entities can link with one another. So with you talking about those patients who have a diagnosis of heart disease and chronic kidney disease, it can be a lot more challenging to treat their disease processes. So when a patient like this, when you're taking care of a patient like this, or they present to you, what are some things that you may discuss with them that they can do to try to possibly slow the progression of heart disease and kidney disease, and or possibly maybe improve their heart and kidney health?
So for a person that I'm seeing who comes to me for, and I'm actually, in our community, a lot of patients will come that, my father had a heart problem. I want to reduce my risk of having heart trouble or things like that. So if I see somebody who has kidney disease, and if they don't have established heart disease, they just have some mild kidney disease, then I really focus very hard on controlling their blood pressure. Then if they have diabetes, I encourage them to start working on that. And just general good lifestyle changes. We know smoking has an impact here. Excess weight has an impact. So first things, if they don't have established heart disease, I would like to educate them, saying that, hey, you are at increased risk, and what are the things we can do to reduce that risk? There are certain pharmacological or medicine interventions that actually can help people who have high blood pressure and mild kidney disease, or protein in the urine can benefit from certain medications that are used to treat blood pressure. And there are some new medicines that can actually slow down the progression of kidney disease and reduce the risk of that down the road. So I think these conversations are important for people to have with their doctors, or if they see a cardiologist, to ask, what can I do to reduce the risk of that, both in terms of my lifestyle, my medications, and are there new ways of doing this? And I think having that conversation on an ongoing basis is important, because new information comes out and there is always the inertia of not changing things. But if there is something that new has come out which can help, then I encourage people to take advantage of that, because that's what medicine is about. Patients who do have heart disease established and have kidney disease on top of that, those patients I would make sure that they're on the right medicine. There are certain group of medicines that help reduce kidney problems and heart problems at the same time. So trying to optimize their medications becomes really important. And the other big area is to, see a kidney specialist to make sure that we can see if there's a treatable cause, okay, other than just, some things are related to aging, high blood pressure, but there might be some treatable causes. So seeing a kidney specialist early on may be useful. And then it's all about preventing any further damage to the kidneys. That could be from avoiding certain kinds of medicines, certain procedures, things like that. So I think, in short, it's a multi-pronged approach, both to preventing heart disease in somebody with kidney disease, using medications and lifestyle to slow down the progress, seeing a kidney doctor, and avoiding further damage. So all those things happen while we are going, helping the patients and adjusting their medicines and going through that.
Okay, and you mentioned medications and lifestyle and things. How important is like a patient's diet, their nutritional status, and their physical activity? How important is that when we're talking about the role of the cardiovascular system and how it affects the kidneys?
I think so. There are like the common denominators like hypertension, diabetes, smoking, excess weight. These contribute both to heart disease and to kidney disease. So I think treating these and preventing, maintaining an ideal body weight, having good habits, good control of diabetes and blood pressure, I think physical activity, weight maintenance, I think are really critical to that. And that's before, to just keep bad things from even starting. And I think that really is a worthwhile goal for that.
Okay.
And along kind of just knowing where we are. I think a lot of times I will see people who were not informed about that they had a problem. Like, did you know that you have some kidney problem? It's like nobody ever mentioned it to me. So I think just looking at their own blood work, labs, and saying, hey, this number looks high. There's a red arrow next to it. What does it mean? And having that conversation and looking into that, I think, is really important. But to your question, Juanita, lifestyle, there is no substitute for a good lifestyle. No amount of medications or procedures can substitute for that. So I highly encourage that. I think it will reduce their global risk of having everything, all sorts of health issues. The risk of those come down when we, do all the right things.
So you're recommending that people know their own numbers. Are we correct? I mean, you have to know what's going on with your body.
Right. So know your numbers, know your family history. If there is a family history of kidney disease, some of them can be inherited. So I think knowing that is important. It's just knowing, I think knowledge is power. So once we know what's on with us, we can take action and make changes in our behavior and be on the right path.
Okay.
Wow, that again, some very good information, because I think sometimes in our society we're so used to the quick fix, what is going to be fast, and sometimes we think that, well, if I take a pill, then I don't necessarily need to do everything else in terms of trying to live a healthier lifestyle, eat healthy, get in physical activity, and manage stress. And likewise, I really like what you were saying with regards to, of course, if someone has heart disease and or kidney disease, you want to treat it with medications and lifestyles. But what's even more important is if we can try to do things to prevent us from even getting to that point, which I think is very key and very important as well. Well, I must say this has just been some wonderful information, and I know it will be wonderful information for our audience. But Dr. Agarwal, I just wanted to open it up. You've given us so many good tidbits today with regards to heart disease and its interaction with chronic kidney disease. Is there anything, I guess, a summary or anything else that you would like for our audiences to know when it comes to heart disease and kidney disease?
I think we don't educate our youth and our younger selves enough that to take care of our bodies. I think we don't emphasize that enough in our 30s and 40s with, our desires that we are invincible and nothing bad can happen. But I really think that's the time to really take stock of our health and really focus. I always tell my patients, this is the only body we have. There's no replacement. There's nothing. So I think being aware that our bodies do need care, and at least do a yearly physical, get to know your numbers, because early diagnosis means that we can do something about it and prevent complications. So I encourage people in their 20s and 30s and 40s to see their doctor, get a baseline blood pressure to make sure they don't have diabetes, get their numbers, make sure their kidneys are doing okay. Especially in the African American community, I think there's less access to health sometimes, and that can play a role in delayed diagnosis. There is a certain resistance sometimes to taking medications because people think, oh, I'm just 35, 40 years old. I don't want to take a blood pressure pill. And that happens. So I think working with your physician and addressing these risks and diseases early on saves us a lot of grief down the road. And I think that's the point, that early management for these diseases and chronic conditions, I think, is really key. And fortunately, we are coming out with some good medications that can help slow down progress and things like that. So I think being aware of it, being proactive about it, is the most important thing, in my opinion.
Okay, we feel like, well, the links are, we're really committed to sharing information about heart health and about kidney health. And we want to encourage people to live their best lives and by taking care of their bodies. And we think, the information you've given us today will help them do just that. We appreciate you being here with us and taking time out of your schedule to share this with us. Timby, do you have anything else you want to?
No, I think Dr. Agarwal did a very good job of summarizing at the end, and likewise, I agree. Excellent information today.
Thank you. It was my pleasure.
We thank you so much, and thank you very much, all right, for taking the time to be with us.
Thank you.